The primary function of the middle gluteal muscle is the lateral stabilization of the pelvis. Additionally, it plays a role in stabilizing the sacroiliac joint. Weakness in this muscle can lead to changes in the position of the rib cage. It helps anchor the rib cage downward. Here is the rib cage, and the middle serratus muscle supports it from below. The antagonist to the middle serratus muscle and its role in rib cage stabilization are the external oblique abdominal muscles, which also attach to the rib cage, and these muscles must remain in balance. When the middle serratus muscle weakens, the rib cage shifts position in this way, causing one side of the pelvis to rotate in that direction. Conversely, if the oblique abdominal muscles weaken, the middle gluteal muscle shortens, leading to the pelvis rotating in the opposite direction. Beyond lateral stabilization of the rib cage, another key function of the middle gluteal muscle is stabilizing the hip joint from a side view. Often, when the middle gluteal muscle weakens, the space between the joint surfaces decreases. The pelvis has a vertical indentation that forms part of the hip joint surface on the pelvic bone. The head of the femur, located on the thigh bone, connects with this surface to create the hip joint. When the middle gluteal muscle weakens, these joint surfaces move closer together. If left uncorrected, this can gradually damage the joint cartilage and ultimately lead to osteoarthritis of the hip joint. This process often begins with weakness in the middle gluteal muscle. Usually, the entire middle gluteal muscle does not weaken all at once, though this is possible, but more commonly, one specific portion becomes weak. The muscle consists of three portions: anterior, middle, and posterior. Each portion is activated during different phases of walking. When the foot is behind at this angle during a step, the anterior portion of the middle gluteal muscle is engaged. At a different angle, the middle portion activates, and when the foot extends forward, the posterior portion engages. If any portion fails to activate, such as the anterior one, during the phase of walking when the foot is behind, hip joint stabilization is compromised, causing instability. This instability occurs briefly when the thigh is behind during a step. Similarly, if the posterior portion is weak, instability arises when the foot extends forward, as this portion cannot properly stabilize the pelvis and support the hip joint. It is precisely at these moments that trauma can occur to the sacroiliac joint itself. During this time, instability of the pelvis may also develop. This can result in injury or, if it happens repeatedly, micro-traumatization of the sacroiliac joint, the sacral joint, the hip joint, and the joint between the fifth lumbar vertebra and the first sacral vertebra, as well as the intervertebral disc. At this moment, the anterior portion of the middle gluteal muscle is active. It stabilizes the hip joint as you push off with your back foot during a step. This portion works specifically at this angle. The middle portion activates at this angle, engaging when body weight is transferred to the foot. Meanwhile, the posterior portion engages when the foot is extended forward. All three portions must generate specific forces to maintain pelvic balance and stabilize the hip joint. When the middle gluteal muscle is weak, the pelvis begins to wobble from side to side. With every step, this lateral movement causes the pelvis to swing, disrupting balance and destabilizing the hip joint. Instead of the pelvis twisting physiologically, allowing forward and backward movement of the pubic bone, the pelvis sways laterally, which is abnormal for the sacroiliac joint. This side-to-side swinging causes constant microtraumatization of the joints between the fifth lumbar vertebra and the first sacral vertebra. It also affects the intervertebral disc in this area due to the repetitive hanging motion. Furthermore, this pelvic swinging contributes to the development of sacroiliac joint instability. If the anterior portion of the middle gluteal muscle is not fully engaged during the step, especially during the push-off phase, the gluteus maximus muscle is unable to exert maximum force. When the foot is behind, the gluteus maximus cannot develop full strength if the anterior portion of the middle gluteal muscle is weak. Before beginning exercises to strengthen the middle gluteal muscle, it is essential to first address all trigger points and sore areas within the muscle. To do this, use a ball and position it directly under the middle gluteal muscles. Initially, remain still, lying on the ball, placing it in the area between the pubic bone and the hip joint. The middle gluteal muscles are located in this region. Shift the ball's position, starting with the middle portion of the muscle, then moving to the back, and finally to the front. Identify the sore areas or trigger points as you do this. Control the pressure applied to these sore spots by adjusting the force used with the ball. Begin by lying still and waiting for the pain to subside. If the soreness is intense, switch to a softer ball, such as a tennis ball. But avoid using spiked balls or other similarly textured ones as they are unsuitable. Denser balls are a better choice. Select a ball size that suits the condition of your muscles. If a small ball doesn't seem to effectively target the trigger points, try using a slightly larger one. Begin by working on the muscle itself. Move the ball to the right, left, up, and down to reach the entire muscle at various angles. If the process feels too painful at first, avoid making any movements. Simply lie on your side and wait for the pain to subside. Alternatively, you can start this exercise while standing next to a wall. In this position, you can apply pressure to the middle gluteal muscle using the ball on all three portions of the muscle. Standing allows you to control the pressure more precisely. If lying down is too painful, begin the exercises standing. Move side to side or up and down using the same technique. These movements can also be performed at different angles. When you lift your leg to the side, the middle gluteal muscle contracts. This can be done standing or lying on the opposite side. If the leg is aligned with the torso during the movement, the middle portion of the gluteus medius muscle is activated. If the leg is shifted slightly forward, the back portion engages. If the leg is slightly behind the midline of the torso, the front portion of the gluteus medius muscle is activated. All three portions should be equally strong, generating nearly the same amount of force. If you notice one portion is weaker, focus on strengthening it by increasing the number of sets rather than the repetitions per set. Once you have worked on the trigger points, proceed to specific strengthening exercises. Lift your foot to about this height, then lower it. Focus on controlled movement to train the muscle. You should feel tension in the middle gluteal muscle, particularly in its middle portion, when the leg is aligned with the torso. Next, shift your leg slightly forward. This activates the back portion of the middle gluteal muscle. As before, raise and lower your leg, and you can increase the load by holding the leg up for a second or by not lowering it completely to the ground. Rest for a few seconds between 5 to 10 repetitions. After this, target the front portion by moving your leg slightly backward. Repeat the same lift and lower motion to train this portion of the muscle. Work on each of the three portions to ensure balanced strength. Prior to this, focus on addressing the trigger points. Additionally, there are exercises designed to stretch the middle gluteal muscle and the iliotibial band. In this case, the leg is positioned in a way that stretches the muscle. But do not start with stretching exercises. If you have weakness in, for example, the front portion of the muscle, the middle and back portions may have become shortened due to compensatory overuse. The portions of the muscle that were active will become shortened. Therefore, you must first address the muscle weakness before proceeding with stretching exercises. Stretching a weak muscle can exacerbate the weakness. This is why it's essential to start with strengthening exercises.